there are at least 10, maybe a dozen different factors that create problems in American healthcare. And most of them have strong lobbies in Congress. So you squeeze on one and it just pops out in another place. It's like that proverbial balloon, right? You've got to attack all 10 or 12 of these factors simultaneously. And the politicians have to grow a backbone and say, yeah, I know the hospital lobby gave me all this money and I should really support them. But you know, I tell you, it's hospitals are part of the problem, doctors are part of the problem, lawyers are part of the problem, the American people are part of the problem. I don't know if you remember an old comic strip called Pogo, a long time ago. The character, the byline for the comic strip was, "We have met the enemy and he is us." Okay? So you cannot, the American people have to be re-educated. You cannot get the very best medical care and get it right away and not pay for it. You can get okay medical care, wait 6 months or a year before you finally get the procedure you need and not pay for it directly. That's been shown to be, you know, the Canadian model, the British model. So that you can throw money at it that way. But if you actually took control of all the facets that I'm talking about, and you took those lobbyists and ran them out of Washington, I think you could easily cut our health care bill in half, easily cut it in half. And by doing so, you could then extend coverage to the people who can't afford it. But this idea that we're going to go ahead with the status quo and just add money to it and extend coverage is a bankrupt idea. It's not going to work. It won't work well.
The budget expands to fill the money available kind of thing.
Yeah. But I'll give you a quick example. And if you ever go into a U.S. emergency room, you know, hospital emergency room, here's when Steve can verify this. Here's what happens. You come in with a headache at 2 in the morning, right? So I got a headache, woke me up. So what do? They don't give you 2 aspirin and say, go back to bed, which is what we did in the military, right? When I was in the military, that's what you did. You say, come on, you malingerer, go back to bed. Here's a couple aspirin. No. They do a head CT. They do a head MRI. They do a spinal tap. They do a multiplanar cervical spine CT, and that guy walks out of there charging, you know, the insurance company, which is you and me, paying for it, charging this guy 10 grand for his headache. Okay? Now, why would they do that? Well, the hospitals don't complain because they're making money. Probably, if they, you know, one way or the other, they're going to make money on that. The radiologists don't complain because they got all these studies they get to make money on, right? Well, that doesn't make it right. So, how does it really start? Is the ER doc making more money by ordering all that? No. But why is the ER doc ordering it? Because he does not want to get sued, all right? Because if that guy with a headache is the 1 in 10,000 that actually has an aneurysm, he'll get sued. And so you have 9,999 people with headaches getting these $10,000 to $20,000 workups for that one person who really has a problem, okay? And as a society, we have to decide, is that what we want to do? And you go across the board in medicine, and breast cancer, missed breast cancer diagnosis is one of the top reasons for malpractice. Okay? So you have people throughout the country, doctors I'm talking about, ordering tests, doing things, doing procedures, doing biopsies, doing surgeries that truly aren't necessary. But they're doing it because if they don't, in the back of their mind, it may not even be conscious, it might be subconscious, in the back of their mind saying, I could get sued, I don't want to get sued. So that whole method of trying to figure out who the bad doctors in the country are has to be changed. It can't be left to the lawyers. They're making a mess of it, and they're driving the cost of health care up unbelievably. And when John Edwards ran for president, he says, oh, it's only 5% of the health care dollar. No way. 5% direct costs maybe. That's maybe what the malpractice settlements are. The indirect costs of defensive medicine are astronomical. I would say at least 50% of our health care dollar. So it's a bunch of different things that have to be done. But the American Society of Breast Disease has their finger on one lever that they can control. They can't control these darn lawyers, they can't control the darn government or the insurance companies, but they can control how the doctors work together and how we can deliver a better product more efficiently, less expensively for the American woman.